In the meantime, ladies and gentlemen, guess who? It's Senator Roy Blunt. Ladies and gentlemen, this guy has been, well, too bad people didn't listen to him over the past 15 years or so, talking about health care reforms and lowering the cost of health care and helping cure a sick system. But now we are saddled with ObamaCare, and now it's starting to be an effort to dismantle some of it. Roy Blunt, thanks for joining us, my friend.
Hey, Jamie, good to be with you, and good to hear. Do you have the power that you can just decide there on the fly that this is going to be the seventh caller? Is that
I
seems
do.
Like a power play on
it
my
really
part.
is.
You just decided, right?
It's an amazing power that I have.
It
yes.
is. If Jamie Allman says it's the seventh caller, it's going to be the seventh caller.
As little power as I have, I got to use every chance I can get when I have some, and so that was when I did the seventh caller thing. I rendered onto all of you the seventh caller.
There you go. There you go.
Hey.
Well, the president has rendered onto all of us a healthcare system that I've always been convinced can't work, and the more people see of it, the more people are beginning to figure out that this is just based on premises that don't make sense. Young, healthy people buying insurance at rates higher than they've ever seen before, and insurance companies not knowing who they're going to get, planning to get people with the worst possible health care needs already, and it's going to have devastating impact, I think, on people's health care. I believe, as I've said on your program many times, that there'll be more people uninsured 2 years from now than were uninsured 2 years ago. And this is a system that the more people see it, the biggest enemy of Obamacare will be ObamaCare.
You know, it's interesting. I'm seeing the Republicans seemingly taking the lead in fixing this, and you've got also people like Steny Hoyer and Dick Durbin saying, well, I don't know whether we're going to take the Republicans up on their offer, which I consider to be a life-saving offer. I mean, listen, let's put it this way. Trying to keep Obama to his promise of letting people keep their insurance, if in fact this bill goes through the House and ultimately makes it to the Senate, it will represent a life preserver for Democrats in 2014. But again, still, it's the right thing to do, oddly enough. I mean, the easiest thing to do would be just to let all the Democrats drown in their own Obamacare mud. But the reality is you all have constituents who are desperate for something to happen, and right now you can't put the people behind the party.
Well, it's hard to know what to do here. The right thing to do clearly would be to scrap this and start all over.
Right.
That's the right thing to do. How we deal with people that have real problems, like I'm going to be talking about on the floor of the Senate later today. Lots of people are contacting us with problems, and I'm going to try every week to be sure that I have a chance to talk about problems like the family in Onogo, Missouri, which is near Joplin, they had a son who was born with hydrocephalus. It's a medical condition where fluid builds up in your skull. He had to have his first surgery at 18 months. 10 years ago, the premiums increased for their family, so they put him in a high-risk pool. The state had a high-risk pool. It was about 135% of what normal insurance would cost. But remember, this is somebody who, going into the pool, they knew he was going to have ongoing problems. That high-risk pool now goes away. Their access to the doctor that their son has had his entire life goes away with it because they can't get a policy that allows that doctor to treat them. This is just a law of unintended consequences of the government thinking they can manage 16% of the economy or be involved in everybody's health care. And we're going to see those. The place, blunt.senate.gov, is a way you can go and share your stories if you're beginning to get your policies canceled, if you see the policy you've had costing a lot more with less benefits. Those are the kind of stories that people need to hear as we decide whether you can move forward with this at all or not. And then the quandary that you talked about, is it the right thing to do to try to patch it here and patch it there, or is it better for people to see that this just won't work and it's a real hard determination
right.
for people to make, like me, who are working for people who now have big problems
right.
That they didn't have before because of this law.
Well, and Senator Blunt, I almost think, at some point, yeah, very few people can afford to let this thing play out, as much as it would probably help Republicans in 2014 because people really see the evil of Obamacare. The reality is, as you just pointed out, you're hearing from people who can't afford to play that kind of game. I mean, they need something now.
Well, I think that's exactly right. And again, people who have coverage in our state, one of the things I talked about for years would be ways to expand the high risk pool. We have 4,300 people in the Missouri high risk pool, all of whom have a pre-existing condition, many of whom have ongoing health care costs, but others just have had a heart attack or something and they're taking care of themselves and they don't necessarily have huge costs, but it's hard for them to get insurance after they've had this incident. But that ends December 31. All 4,300 of those people are going to do whatever it takes to get coverage, I believe. And the problem is that young, healthy people are going to be the first people to say, well, I haven't had insurance up till now. I'm young, I'm healthy, I'll get insurance sometime, but why do I want to pay 50% more than I decided last year I couldn't afford to pay? And so the premise of those two things coming together doesn't work, but that doesn't mean that the people who have a pre-existing condition, the people who have already been using their policies don't need insurance coverage. The problem is they just may not need the insurance coverage that President Obama says is the only coverage that's good enough for you, and that's one of the big problems here is the government deciding what your family needs in insurance instead of you being able to decide in a bigger marketplace what your family needs in health insurance.
Yeah, go figure. We could have told people that was going to be a problem years ago, but no,
and we were.
Yeah.
And we were. You and I have both talked about these same things since 2009 when this bill passed.
Right.
We are not last-minute converts to saying, whoa, this is a real problem we hadn't seen. We've known, you and I have talked about this many times. The president got this passed. He got this passed by the narrowest of margins, and he got it passed without being willing to reach out and create any bipartisan support. Not a single Republican in the House or the Senate voted for it. And you could have done things, I'm sure, to get one Republican somewhere to vote for it, but the president decided, no, we're going to do this exactly my way. We're going to do it exactly like Nancy Pelosi and Harry Reid and I want to do it, and the country is going to be better off because the government knows so much more than the people do. And as it turns out, that's never the case, and it's not the case here. People can make decisions better for themselves. We should have gone for a direction that gave people more choices, like buying insurance across state lines. Anywhere you could find insurance in the country that was available, if that met your needs. As I've said again there in the studio, if you live right across the river in Elton, Illinois, there's no reason you shouldn't be able to buy a policy that your brother-in-law in Missouri can buy, or there's no reason your family couldn't be able to buy a policy that you could buy 3 miles away. And a bigger marketplace would have been better. What the government's done now is make the marketplace smaller by defining what counts as an insurance policy in the government eyes and what doesn't count if you have insurance that worked for you but it didn't meet this new standard.
All right, Senator Blunt, always good to talk to you.